So good morning, everyone. My name is Ruby Vargas. I am a Cover California Certified Enrollment Counselor at Community Health Partnership. I began enrolling clients since 2014, so that was soon after the full implementation of President Obama's Affordable Care Act. Before then, millions of California residents had no real access to affordable health coverage. I remembered our clients telling me of how often they would go to the emergency room for any type of situation, which most often that situation could have been prevented or treated easily if they had health insurance. I also remember that when I began enrolling clients into Cover California, mostly families, of how excited they were to get health coverage. The ability to get health care for themselves and their children was life-changing. This is because Cover California provided preventative care, which for them, this meant that their kids no longer would miss school and they no longer missed work due to a preventable illness. And for others, it also meant that they were able to get treatment for an existing medical condition. Having health coverage also meant that there was less financial uncertainty in their already stressful lives. Even those who came to sign up for coverage just because there was a law, they realized of how great the program was after I explained the benefits. With reasonable deductibles, co-payments, and free preventative care, Cover California, it's a great program for our clients. However, now with the potential passage of the American Health Care Act and the loss of the affordable health coverage, many people have expressed fear and panic. I have gotten a couple of clients who think that just by getting health coverage, they're going to be deported even if they are green card holders. Also, and even though they feel safe at our environment offices, they are afraid of entering government buildings. I pretty much want to tell our leaders to realize that the Affordable Care Act is working and has saved lives. Just when people are able to have control of their health, that safety net is being stripped away. Meaning that basically now that clients or the general people are now getting used to having a primary care doctor, they now know where to go whenever they get ill or sickness, and not only that, they know where to go for preventative care, which that was something that the emergency room did not provide it. Taking away essential health coverage, especially preventative care, will sentence our most vulnerable to cause them physically to suffer and also to face financial struggles. This is because their once untreated medical conditions are now under control. But without health coverage, they are destined to return to a life of chronic illness and pain. Thank you.